guys. I want to thank you guys for coming out here tonight to invest your time and your wellness in being here. I'm really excited to share this information with you. So let's jump right in because we got a lot that's going to go on tonight, but I want to promise you by the end of this, I'm going to wrap all this up in a nice, neat little bow. So by the time that you guys leave here, you will understand what causes seasonal allergies and asthma and what you can do about it. So tonight's agenda, what we're going to be talking about is we really need to deepen our understanding of how the body works. Because when something goes wrong and you don't know how it's working and operating, then how do you know what to do to correct it? So we're going to really deepen your understanding of that. We're going to talk about the causes of allergies and asthma. And then more importantly is that there's actually a priority sequencing that has to occur when you want to heal. And we'll get into that in a little bit. But first, let's talk about some health statistics in this country. And I'm not sure if you guys are aware of this, but we spend the most on health care than any other industrialized nation in the world, right? $4.1 trillion in health care in 2020. That comes out to about $12,530 per person. This is $4,800 more than Switzerland per person, and Switzerland is number 2 at spending the second most on healthcare in the industrialized world. So what do we get for this $4.1 trillion? I mean, you think we would get a lot for it, right? But what do we get for it? Well, 60% of Americans have one chronic degenerative disease. And what are those chronic degenerative diseases that the CDC says that people have? Well, heart disease, cancer, chronic lung disease, stroke, Alzheimer's, diabetes, kidney disease. And these are non-communicable diseases, meaning that you can't catch them from everybody or anybody, right? These are things that are going wrong in your body, and in a way, we have to kind of earn these diseases. The same way that we have to earn health, we have to earn these diseases, and by breaking down the body and abusing it over decades, right? That's why they call them chronic degenerative diseases, is that we abuse our bodies to a point that over decades, it just breaks down. I mean, do you know how hard it takes to get diabetes? Do you know how hard it gets to get heart disease, right? Like, you got to put in the work and the effort. You know what I mean? It's not something that you just wake up one morning, you know, when you're 20 or 30 that you get this, you know, over decades of just your body deteriorating. What we also get is that 40% of the population has 2 or more of these. So $4.1 trillion, right? We're getting a lot for our money there. The Commonwealth Fund, which is a nonprofit organization, puts out a report every few years. And what they look at is they analyze certain healthcare systems of 11 high-income countries. And these are the 11 countries that they analyze. Guess where the United States falls in there? Yeah, 11th. They rank dead last as far as the healthcare system itself. Now, they do this report every few years, and they've done 7 since 2004. And the United States has ranked last in every single report. So not only do we spend the most, but our healthcare system sucks the most too, right? So why is that? Well, the VP of the Commonwealth Fund, Reginald Williams, he said that it appears that the United States delivers too little of that care that is needed, that is most needed, and often delivers that care too late, especially for people with chronic degenerative diseases. And I couldn't agree more with that. And if, you know, you'd say a picture says 1,000 words, well, how can I wrap this up into one picture? And I think this says it all. Right? People want pills and surgery. They don't want to be accountable, and they don't want to make lifestyle changes. People are simply not held accountable for their health in this country. But the other thing, too, is that we are not taught how to take care of ourselves. This is a big part of what I do with my practice and my patients, is educate my patients on how the body works and what you can do to own your health, because we're also not taught how powerful the body really is. And when you don't understand those things and you think that health happens to me, it's not something that I earn, just like heart disease or cancer, you have to earn that. And the reason being is what I like to call defensive health, right? People wait for a crisis to occur before they take action. So you have a weakened body. You have to manage the environment in your surroundings so that that weakened body can then survive in that environment. You wait for a crisis to occur before you take action. And what is the action usually? Medication, right? Don't worry about your stress. Don't worry about getting up off the couch and quitting your Netflix marathon. Get outside and move. Stop going to McDonald's and actually eat whole foods and fruits and vegetables, right? That's just too much for people to do, okay? But what I like to do is in my practice, I call it offensive health, right? You have to create and build that health on a daily basis. And how do we do that? Well, you have to know yourself. You have to know what's going on in your body. You have to know how the body works. And it's really not that hard, but we just don't have that opportunity to have that education in our lifetime. We take action before we have any issues by creating healthy habits. We strengthen the body. This way, the environment doesn't matter and it doesn't affect you. So when you come at your health from this perspective, right, you'll be able to be much more functional and live up to your fullest potential. Because again, disease and health, they're both earned. It's not something that you just magically have. Does that make sense? Any questions? Okay. If you have questions during any of this, just feel free to speak up. All right, so let's dive into the body and some basic concepts of the body. So there's something that's called homeostasis. And homeostasis is this internal mechanism or machine that has to maintain the internal environment. It's the body's ability to maintain the consistency of its internal environment despite changes in the surrounding. And this is the responsible of the hypothalamus in the brain. It is responsible for running homeostasis. Now we have 11 organ systems that have to maintain homeostasis. And these are the 11 organ systems. So I want to take note on here of there's 4 organs of elimination of how the body gets rid of toxins. We have our digestion system, which has to break down the food, but it's also part of the bowel and being able to eliminate toxins from the food that we eat. We have the skin, which is also a protective barrier of keeping things out from our external environment, but it is also an organ of elimination. I mean, how do you explain rashes, hives, things like that? It's the body trying to get toxins out, right? Acne, when adolescents have acne, it's the same thing. We have the respiratory system, our lungs, and then we have the urinary system and our kidneys and our bladder. So these are 4 organs that the body has to eliminate these toxins from our system. And I'll show you how that's going to come into play a little bit later with allergies and asthma. Now, the thing I want you guys to understand about homeostasis is that it forces relationships in the body without exception. What do I mean by that? Has anybody ever gotten sick and lost your appetite? Right? Very common. Well, why does that happen? Have you ever wondered, why does that happen? Well, it takes your body an enormous amount of energy to run your digestion system. It also takes your body an enormous amount of energy to run your immune system. So if you have a bug or a bacteria or something that is literally trying to kill you, your body's like, I'm not worried about digesting food right now. We need to conserve all of our energy and put it into the immune system to fight this thing so that we can get back to living. So then the appetite goes away. And then once your body's strong enough and your immune system's got a handle on it, then what happens? It kind of comes back, right? That's just one example of how it forces relationships. You go outside to go for a brisk walk, right? What needs to happen? Well, you got to start breathing faster and your heart's got to pump faster, So when you have certain situations that are going on, your brain in homeostasis, it forces relationships. And I want you to understand that it's kind of like the mob, right? Don Corleone, right? When the top dog, yeah, settle down. When the top dog makes the decision, everything else follows the chain of command. So there's a priority system of how things happen in the body. Now, the thing about homeostasis is that these 11 organ systems are totally dependent upon two things. Number one is that your organs need to have clear communication to your brain. So when your spine is subluxated, this interrupts the communication to your brain, and your organs can't function properly. The second thing that it needs is it needs the proper nutrition, okay? Has anybody ever started an exercise program where you start working out more consistently? Whatever happens to your appetite when that happens? It goes up. Why? Because you're putting more of a physical demand on the body. Your body's like, hey, feed me, you know? So it needs more nutrition. So even if you're not doing physical activity and we're having more of this emotional stress in our lives, your body requires more nutrients to be able to combat that. So what happens when you've got more bills than money at the end of the month? Who do you pay first? Well, you're going to pay the one that's going to hurt you the most, right? Yeah, exactly, right? Waste management, you know? But this is how your body sees it. Your brain sees it no other way. So your brain in homeostasis needs to do what it needs to do to keep you upright against gravity. So if it's going to rob nutrients from this organ system or this tissue to feed this, then that's exactly what it's going to do, okay? So that's one concept that I want you guys to understand. The second one is innate intelligence. And I think I've talked to you guys about that before, but I just want to go over that briefly, what that is. So this innate intelligence is this inborn intelligence that is present in every single cell in the body. It's also present in animals and plants. Innate intelligence is what animates the living world, okay? Now, this force is responsible for the organization, the maintenance, and the healing of the body. I mean, how else can you explain when an egg and a sperm come together and form one cell, and in 9 months, you've got a little baby that's fully organized and is 50 to 70 trillion cells? How does that happen without conscious thought? This is the work of innate intelligence. It is constructive. It's also an adaptive power for survival. The key is that this is actually expressed through the nervous system. So when you have subluxations, it reduces innate intelligence to actually do the healing, which is why chiropractors are so hellbound on adjusting the spine, talking about posture, strengthening your spine, because we understand and we bank on this and have faith in this with every one of our patients. The other thing you guys might not understand is that innate intelligence is present in every single cell, but every cell is programmed for well-being. Like, well-being is our natural state. So if this is true, then why are people sick? And we'll get into that later. I mean, imagine a wisdom that is so great that it knows more in 1 second than we will ever consciously know in our entire lifetime. Like, think about that. Like, that's crazy. But it's so true, right? We don't need to outsmart our body. Our body knows exactly what to do. Innate intelligence and homeostasis, they are on the job every single time, and they get it correct every single time. We just got to give them the right support in order for them to do their job. It's kind of like getting out of our own way. Now, if we were to kind of simplify what health versus illness looks like, this is kind of what it is. When you are healthy and strong, your body is balanced. And I'm not just talking about your physical body, but your mind, your body, and your spirit. Your spine is properly aligned, so you have proper communication from your brain, your body, and your organs. You have this inner peace that's about you. You don't have any sort of underlying anxiety, depression, relationship issues, emotional stuff that's going on. Your body is nutritionally balanced. And when this happens, your body can function like it was supposed to, like it was designed. When we have illness, you have a weak or out of balance body, mind or spirit. Your spine is subluxated. You have a loss of this inner peace. Your body and organs are malnourished, and it causes the body to become dysfunctional. So this is kind of what I've come up with that is health versus illness in its most simplistic form. So what are the three causes of illness, right? We've got mechanical stress, emotional stress, and nutritional stress, what I like to call men. Men are the cause of all disease, okay? So mechanical stress, we're talking about subluxations in the spine. And what I mean by subluxations is where the vertebrae are misaligned and is putting pressure on the nerve and is disrupting the communication between your brain and your body. When this occurs, organ systems and tissues, they don't have that expression of innate and they can't do their job. Poor posture, we're going to get into that a little bit later too. Musculoskeletal injuries. Emotional stress, relationship issues, negative self-talk, anxiety, depression, money issues. Life just happens sometimes, right? But it's not what happens to us that matters, it's how we handle it. And then nutritional stress has to deal with diet, but also your body's ability to digest and absorb what you put into it. Just because you put food in your mouth and you swallow it, doesn't mean that your body can digest it or absorb it. I mean, I have patients that come to me all the time that eat very clean, they exercise regularly, but yet they still have all these health issues. So it's not a question of their diet and lifestyle, it's more of a question of how their body is functioning. And when we correct and strengthen the body and its ability to function properly, then it will perform the way that that lifestyle and diet is designed to. Now, we have mechanical, emotional, nutritional stress. So let's kind of get into this a little bit. How does your brain and your body respond to all three forms of this stress? Well, it does not matter what combination or what form it's in, your body is going to respond the exact same way every single time. The first thing that's going to occur is your body's going to burn more nutrients, okay? When this happens, you're going to have nutritional deficits in the body. The other thing that's going to happen is you're going to create more waste, which is then your internal environment is going to become toxic. And when you have this nutritional deficit that grows in your body, when you have this toxicity that starts to grow, how does your body compensate for those issues? It does it one way and one way only. It causes muscle contraction. And muscle contraction, where could that be? Could be anywhere where your weak link is. It could be in your calf, it could be in your quad, your hip, your low back, your shoulders, your neck, your arm, your wrist, wherever, right? Everybody is different. We are our own walking set of chemistry because everybody perceives stress differently, everybody handles stress differently, therefore your body is going to respond differently. So when you have that muscle contraction, what is that going to cause? Subluxations in your spine and posture deviations. And when that occurs, you're going to have nervous interference and a decrease in communication with your brain. So when we have subluxations, I want you guys to understand that when we have subluxations in our spine, it alters and causes stress in your brain and your nervous system. So whether there is a physical bear that walks through that door and it's here in this room, we got to do one of two things. We're going to stay here and fight this thing, or we got to run away, right? So whether that bear is physically there or whether it is imagined, your brain is going to handle the exact same way. And we get into that sympathetic fight or flight mode, okay? Now, when these things happen, your body becomes malnourished, it becomes subluxated, the body becomes weakened and dysfunctional, and it exists in a weakened state. This is the perfect environment for disease to set up shop. So how does the body handle this stress? There's two systems that combats the stress that is the first line of defense. One I just mentioned, which is the sympathetic nervous system, where we have this fight or flight response. Now, this sympathetic nervous system is only supposed to be turned on short term. The opposite of that is the parasympathetics, which is the rest, digest, recuperate, heal, and reproduce mode. So it sits on this teeter-totter, okay? This is the gas, this is the brake. So when we become dominant sympathetically, it weakens our digestion system and it decreases our ability to heal, and it can throw off the immune system and digestion. So we got to get that back into balance. So when we become sympathetically dominant, where do we feel that in the body? Where you feel it right there at the base of your skull. That is that sympathetic dominance. It's also that type A personality, right? People that worry a lot, people that are driven, people that do a lot of critical analysis with their brain and their thinking. That can also cause people to become sympathetically dominant. How do you know? Well, then you start to get sleep issues. You lay there at night to go to bed, and you're laying there in bed for an hour or two before you actually fall asleep. So you have a hard time falling asleep. You can get headaches. This is where sinus and allergy issues can come into. Because when you have those subluxations there at the base of your skull, the nerves that come out from there go up into the head, ears, eyes, sinuses, jaw. So when you decrease that communication to those systems, they're going to be overly sensitive to the environment. And then the last thing it does is it weakens your digestion system. And I'll show you exactly how that does, how a muscle contraction and a subluxation here at the base of your skull negatively affects your gut. So then you can get bloating, gas, heartburn, constipation, diarrhea issues. So that's the one way, the nervous system, that our body combats stress. The second way that our body combats stress is through the hormonal system and the adrenal glands. The adrenal glands are the little walnut-sized glands that sit on top of the kidneys. And they are responsible for hormonal balance in the body. So what happens when the adrenals become fatigued and nutritionally out of balance, how do you know? Well, you're going to get blood sugar issues, right? Hypoglycemia, up and down, up and down. Your blood sugar is not on a tight rope like it should. You get lightheaded when you miss meals. This is where moody and irritability can come into play, anxiety, depression. Now you get a different form of insomnia with this, where you can fall asleep fine, but then you wake up in the middle of the night, it's like 2 o'clock comes and you're like sitting there twiddling your thumbs for an hour, right? You can't stay asleep. This is also a sign of adrenal exhaustion or fatigue. You can get energy issues too, because if you're not sleeping well, you're going to have energy issues. And the other thing is that you crave sugar or salt. And then an overuse of caffeine or coffee. So people that eat coffee or drink coffee all day. These are also signs of adrenal fatigue. Now, when we are under stress, these are the two systems that get affected, or the first line of defense. Now, you can stress out both of these systems at the same time, or one may be more fatigued than the other. So they're not always together and in cahoots, but a lot of times they are. Okay? So now, what do you think causes seasonal allergies? What do you guys think? Why do people have allergies? Pollen. Okay. So if we had a fan here and we had 100 people in this room and I threw up a bunch of pollen here and sprayed it over the whole room, every single person in here is going to react to that.
A big portion would.
Okay. A big portion would, okay. But why doesn't everybody then? Why are some people plagued with allergies and not others?
Genetics.
Okay. Anything else? I'm putting you guys on the spot here. So if it was truly the environment, then everybody would respond to that, right? Genetics has a very little part of that. Everybody is born with genetic strengths and genetic weaknesses. It just depends whether or not you're prone to having heart disease in your family or arthritis or cancer, it doesn't mean that that gene actually has to express. Yes, you can have that predisposition, but whether or not that gene is actually expressed is just like turning a light switch on and off. And that light switch has to deal with your diet and your lifestyle. So you can have those predispositions to it, but those genes never have to be expressed. And research has shown this over and over again. You can turn genes on and off with your diet and lifestyle. So the gene component is very, very small. Okay? Well, to put it in a simple form, to put it in a simplest form, your body's weak and out of balance. You have subluxations in your spine, right? Up here at the base of your skull, C1 to C3, but then also T10 to L2 in the lower thoracic and upper lumbar spine. So you understand that the nerves that come out from the upper cervical spine go up into the head and can affect the sinuses negatively. The nerves that come out from T10 to L2 go to your kidneys, goes to your small intestine and your large intestine. And I'll connect the dots with those organs a little bit later. You can also deal with posture issues, right? When people have this forward head posture, it is going to negatively affect the base of your skull. Poorly managed emotional stress. All right, I'm going to go over that in a little bit too. Poor diet and weak digestion. And when you have poor diet and weak digestion, this leads to leaky gut and inflammation in your gut. Then it leads to toxicity and lymphatic congestion. So if this is what causes seasonal allergies, well then what causes asthma? Well, kind of the same thing, except the only difference is the areas of subluxations. T1 to T4, the nerves that come out from those upper thoracic spine actually go to your heart and your lungs. So when you have subluxations at those levels, and I'll show you in a little bit how when you have this forward head posture and these rounded shoulders, that it's going to put more strain on the spinal cord and the areas in the upper thoracic spine. So I want you to understand that there is a certain sequencing of what happens in the body to make it sick. Like we have this first domino that falls over, and then it starts this whole cascade, and then the 12th, 13th domino is your sinus allergies and your asthma, right? And when most people, what do most people do for their allergies and their asthma? They take medication, right? Give me some Allegra or Claritin and give me an inhaler. So they're only dealing with the 12th and 13th domino. They're only dealing with the symptoms. They're missing this whole other cascade that is happening beforehand, which is why, do you ever know anybody who has asthma that's gotten rid of it? You know anybody that has seasonal allergies that got rid of it? What about people who have thyroid issues? They're on thyroid medication. They ever go off the thyroid medication? Or what about high blood pressure? Prilosec, people have heartburn, right? How long did it take Prilosec for? Forever, right? So can you see why when you're only dealing with the symptoms, you're spending the most on healthcare, you're ranked the 11th out of 11 countries, and you don't get the results because these are non-communicable diseases. The one thing where the healthcare community or the medical community does really, really good at is acute or crisis situations. They do really good at that. They own that. They also do really good at disease management. But when it comes to functional issues or chronic degenerative diseases, that's all they got. Give me this drug for this medication or this drug for this symptom. And I want you to understand that drugs do not heal. They may be necessary to help you function and get through your day, but they do not heal the body. You have to look at everything else that's occurring as to why these symptoms are happening. And what happens? Well, when you have poorly managed stress from men, mechanical, emotional, nutritional stress, you have subluxations and posture imbalances that occur in the spine, so it disrupts the communication between your brain and your body. It weakens it. You get sympathetic dominance, which weakens the digestion. This also overstimulates your immune system because 70% of your immune system is located in your gut. And if you can't digest your food and you have leaky gut and it's inflammation, who has to clean that mess up? Your immune system. So this is where a lot of autoimmune issues come from. You get nutritional imbalances and then you get bowel toxicity. Who's got to clean up that mess? Well, everything that's happening in your bowel then gets shot into the liver. Your liver has to detoxify that. Your spleen is also a filter, and your kidneys. So the liver, spleen, and kidneys are basically filters in your body, and they got to clean up that internal environment. When they can't do their job because they've got too much work to do, I mean, imagine your liver is a Starbucks, okay? You know how big Starbucks are, right? Now imagine there is 20 school buses of football players that pull up to Starbucks, and Starbucks has to service all 20 of those buses. It's going to take a while before you get your coffee, you know what I mean? That's the exact same thing that happens in the body. Is a good analogy, is that when your filters can't do their job, they require more nutrients in order to be able to do that. And when they can't get the job done because the workload is too big, then that's where the body runs into problems. And when they can't do their job and filter out the blood, and you have stress on your bowels, your lungs, and your skin, remember I said organs of elimination, right? A lot of times when people have allergies or asthma, they're constipated. They have bowel toxicity. Well, what are the lungs? They're an organ of elimination. You're trying to get the toxins out of the body. So if your bowels are overloaded, your lungs are overloaded, your kidneys are overloaded and can't get rid of the toxins, and you don't have a rash, where's the overflow valve for that and all that toxicity? Right here, your sinuses. So those toxins are sitting there, and then you just happen to walk outside and breathe in that pollen or that hay fever or that pet dander or whatever it is that you seem to be allergic to. Guess what? You've got an allergy issue. But what were to happen if those toxins weren't there to begin with? Would you still have those reactions? No. So that's how seasonal allergies actually occur. Or even with the lungs, right? You're breathing something in and you have something that triggers it. And I'll show you in a little bit how emotions are tied to these organs too. So then once your organs of elimination can't eliminate these toxins, then it clogs up your lymphatic system. And it creates a whole body toxicity, and these toxins just circulate around and around and around and around in the body. And how do people get chronic degenerative diseases? Heart disease, cancer, stroke, Alzheimer's, diabetes, lung disease. You notice on that CDC thing, lung disease and kidney disease were on there too, right? Well, why? Because it's an organ of elimination. So if you can't get rid of these toxins and your lymphatic system is congested, do you think it's going to stress those organs and cause them to break down? Yes. What if those toxins weren't there to begin with? Do you think you would be healthy and vibrant and be able to live a long life? Yes, you would. So there's a certain sequence of events that actually occurs in the body. And then you get your weak link, your sinus and allergy and asthma issues. So mechanical stress. We're talking about subluxations. What it talked about is a misaligned vertebrae causing nerve interference. And when I'm talking about nerve interference, we're talking about how the nerve transmission itself doesn't actually get there. And research shows that when you have an irritation on a nerve or a subluxation, it can actually decrease the nerve communication between 40 to 60%. So let's just say, call it in the middle, 50%. When you get up today and you go about your day, how important is communicating to others what you're doing or intention to get through your day, right? It's pretty important. But what if only word and done, right? So when you can't communicate properly, is the work actually going to get done? No. So it's the same thing that happens in the body. is that when the brain's sending the signal down, or the organ or tissue sending the signal up, and it doesn't get there, your body and your nervous system can't respond appropriately. So this is where subluxations really have a decreased function in the whole body and can weaken it. It contributes to sympathetic dominance and posture deviations. Well, how do you know? Well, if you look in the mirror and you have one ear that's tilted and your head is rotated, then you have a subluxation there at the base of your skull. Do you have to have pain? No. Do you have to have a muscle contraction? Yes. You just might not know it. It might be more of a stiffness or a tightness there, but it doesn't actually have to be pain. Because when you have this forward head posture too, it's going to straighten the neck and your spine, and you can see how it will then put extra strain on the upper thoracic spine. So when you have poor posture and this forward head posture, what actually happens, and what does the research show? This forward head posture can add up to 30 pounds of abnormal leverage on the cervical spine. And this can pull the entire spine out of alignment. This can pull the entire spine out of alignment. How important is anything below the neck in your body, right? So if you have this tension that's there, it's going to negatively affect the rest of the body. Forward head posture causes the suboccipital muscles to remain in constant contraction and can put pressure on the 3 suboccipital nerves. So in other words, when you have this forward posture leaning forward, if these suboccipital muscles here at the base of your skull didn't contract, you'd just be looking at the floor. So they got to keep your head contracted so your eyes are up along the horizon. What research also shows is that this forward head posture can result in a loss of 30% of vital lung capacity. So again, nerve and communication and subluxations are really important for organ function. Now, let's switch gears a little bit. That's kind of the mechanical stuff that's going on, but let's talk about the emotional component. Did you guys know that there are certain emotions that are tied to organ systems? Did you know that?
I did not.
Okay. That's why I'm here. So, for example, the lungs, grief and sadness. People that have lung issues, right? Are they overwhelmed with grief or sadness, loss, right? Emotional stuff, something that's just kind of eating them up inside. Spleen has to deal with excessive mental work, worry, dwelling, focusing too much on a topic. Liver has to deal with anger, resentment, frustration, irritability, and bitterness. Kidneys, fearful, weak willpower, insecure, aloof, and isolated. And then heart has to deal with joy, but it can also come from an imbalance of joy too, where a lack of enthusiasm or vitality, mental restlessness, depression, insomnia, and despair. So have you ever gotten really angry at something, or something happened to you and you get really, really upset? If you sat down and ate, do you think you're going to be able to digest your food? Yeah, probably not. What would happen to your blood pressure? You got really angry at something just ticked you off, right? It's going to send your blood pressure through the roof. So our emotions that are tied to certain organs can then throw a wrench in homeostasis and throw everything out of balance. So as you can see, what are the 3 main filters in the body? Spleen, liver, kidneys. It's amazing how certain emotions are tied to them. So people that are fearful, right, they have weak kidneys, right? And kidneys is the end point of the lymphatic system and is a way for the body to get rid of toxins. Is it starting to make sense? Starting to connect the dots here? Could it be that easy? Yeah, it is. All right. Then switching to nutritional stress, right? Diet. What is on the end of your fork? Now, we are all 100% responsible for what we put into our mouth because we have control of what goes on the end of our fork. So if you have certain things on the end of your fork, like what's on the left fork here, if you eat a staple of the standard American diet or the SAD diet, then you're eating nothing but empty calories, food-like substances, genetically modified foods which are loaded with toxins and chemicals. And when you eat these things consistently, you are creating inflammation, disease, and you're speeding up your aging process. So this is where the degeneration is actually going to occur, and sooner than later. Or if you're choosing what's on the right side, you're eating more nutrient-dense foods that actually nourishes your body and your organs and your cells, and this actually builds health. This is where that health is earned and where disease is earned. It supports homeostasis, it fights disease, and it slows down the aging process. Now, the thing with diet, and even just general lifestyle factors and being healthy, I like to say that the 80-20 rule, right? You have to be able to enjoy life, but at least 80% of the time, you need to be doing things well and living a healthy lifestyle, and you can enjoy some of that 20%. So if we have 21 meals a week, breakfast, lunch, and dinner times 7, you get 21 meals. 17 of those meals, if you're eating healthy and clean, then the other 4 you can, enjoy stuff, right? I mean, I enjoy eating pizza and ice cream. I enjoy whiskey and having a beer. Like, I enjoy those things, but I don't do it every day. Okay? Don't get the 80-20 rule mixed up, where 80% of the time you're eating crap and 20% you're putting nutrient-dense foods in there. Okay? Make sense? Okay. Now, so diet is part of the nutritional stress, but the other component has to deal with digestion once you actually swallow the food. And once you swallow the food or put food in your mouth, where does digestion begin? Well, you have to chew your food thoroughly. And it's funny when I tell my patients this, that this seems to be like the hardest thing for most of my patients. They come back and like, Doc, I can't chew my food. Like, no, you can. You just have programmed yourself that you don't make the time to sit and eat, and you take 3 bites and you swallow your food whole. And you wonder why you have health issues or digestion issues. Now, for some of my patients, it's not a problem at all. But most of them are like, they have to really focus on slowing down and chewing their food. Making sure you have adequate secretions in your GI tract to be able to finish the digestion process. Then you got to have proper communication between your brain and your nervous system to your gut so that you can actually digest your food. So what are we talking about here? Well, this is where the vagus nerve comes into play. And the vagus nerve comes down from the brainstem here, and it innervates your heart, your lungs, your stomach, your liver, your gallbladder, your pancreas, your adrenals, all the way up into the first half of your intestines. So when you have a subluxation up here at the base of your skull, because you're sympathetically dominant, or you have this forward head posture, or you've just never been to a chiropractor and don't get adjusted regularly, that then decreases the function or the communication between your brain and those organs, and it decreases the function of all those organs. So when you have a decreased in vagal tone to the gut, what actually happens? This is where you get a decrease in hydrochloric acid production in the stomach. You have a decrease in enzyme secretions, so you can't digest your food. You have a decrease in bile flow. And why is bile flow important? Because the bile is helping get rid of toxins from the liver, but it also helps with bowel movements. So if you have a decrease in bile flow, the chance of you being constipated goes up dramatically. It also decreases gut motility and decreases blood flow to the gut. So what causes all these things are subluxations, posture issues, and sympathetic dominance is what causes this decrease in vagal tone to the gut. So what are the consequences of weak digestion? Well, what happens in the small and large intestine is a direct result of what's on the end of your fork and your body's ability to digest what you're eating. So when you have weak digestion, what actually happens in the small intestine? Well, poor digestion equals big pieces of undigested food. It could also be toxins or poisons from those genetically modified foods, such as glyphosate and other artificial sweeteners and crap that they put in there, your body is not going to digest that well. So when you have weak digestion, who's got to clean up that mess? Your immune system. So when you have an abnormal response to a protein or an undigested food, this is where people get allergies. They can get food sensitivities too. Gluten, dairy, whatever they're sensitive to. Because your immune system also sits on this teeter-totter. You've got your innate immunity and you've got your acquired immunity. And they work in tandem with each other. But what happens is that, again, just like the sympathetics and the parasympathetics, it can get tilted one way and get locked there. This is where hypersensitivities come into play, and this is also part of your allergies. So just by having weak digestion or a poor diet over and over and over again, you're overstimulating your immune system. It does have its breaking point, and this is where autoimmunity comes into play. But if you catch it soon enough, you can reverse that. Dysbiosis occurs, where you have an imbalance of the microbiome in the small intestine. This then leads to leaky gut issues, where you then have autointoxication. You have damage to the mucosal lining of the gut and inflammation. The food and toxins and poisons get into the body that are not supposed to be there, and an overstimulation of the immune system. How do you know? You get a lot of bloating and gas below the belly button. That's where the small intestine is at, down in there. You can also have it above the belly button too, but it's more in the stomach area. But for the small intestine specifically is where you get it below the belly button. So what else happens when you have your small intestine is out of balance and your microbiome is out of balance? You get food sensitivities. Crohn's disease is in the small intestine. Constipation, diarrhea could occur. You also get malabsorption issues and your body becomes malnourished. What is the results of poor digestion in the large intestine? Because the large intestine is after the small intestine, and it just kind of continues on. Well, you have the unfriendly bacteria that feed on the undigested food, and they produce a chemical byproduct. There's lots of different chemical byproducts that bacteria can produce, and collectively it's called indican. There's about 38 different molecules or chemicals that these bacteria can produce, but collectively they're called indican. Another word for that is that this food then rots or putrefies, and this can create bowel toxicity. So when you're not eliminating appropriately, the food then starts to ferment and putrefy and rot in your gut. And where do these toxins go? These toxins then have to be reabsorbed back into the body, or the indican is reabsorbed back into the body. And who has to clean that mess up then? Well, your liver and your kidneys. You know, I have an analogy of this, of what bowel toxicity really looks like, that you can kind of wrap your head around this. So when people are constipated, this kind of happens like all the time. So I want you to imagine that you just had a very big bowel movement in your bathroom at home. You do not flush the toilet, you close the lid, you close the door. You go away for the weekend for 3 or 4 days. Oh, it's also 95 degrees out and you don't have the air conditioning on. You come back to that bathroom after 4 days, what's that gonna smell like?
A wreck.
Yes, a wreck, exactly. But this is what happens in the body. So you can, just the odor and the stench of that. But when people are constipated, this is what happens in the large intestine, and they have this bowel toxicity that has to go somewhere. So your body reabsorbs it, it gets back into your system. Then it makes more work for the liver and the kidneys. And when the liver and kidneys the kidneys got to excrete that stuff, which where you get indicanuria, which is just mean that you're peeing these toxins out. And when that happens, this is where the lymphatic system can then become congested, and you get this whole body toxicity. So the lymphatic system, do you guys understand what the lymphatic system does in the body? So think of your lymphatic system as the sewer system of the body, right? It collects all of the waste, the debris, the toxins and everything, and it's got to dump it back into the bloodstream for the liver and the kidneys and the spleen to then filter that out. So it's kind of the sewer system. So imagine you had 18 inches of sewage on the first floor of your house. How long would you be able to live there before you got sick? Right? So that's what lymphatic congestion is like in the body. And it is very serious stuff. And this is why people, when they have lymphatic congestion and their liver and the kidney and the spleens can't filter this stuff out, can you see then how it just circulates around and around, and it's very easy for that body to then have a chronic degenerative disease very quickly. Make sense? So what are some symptoms of indicanuria? Well, I'm so glad you asked. Here's a list of what people can get broken down by system. So you can get skin, hair, and nails. You can have dermatosis, eczema, psoriasis, eyes, ears, sinuses, diseases of the sinuses, ears, eye strain, foul odor in your urine, tachycardia or a fast heartbeat, cardiac arrhythmias, where your heart is off a beat, migraines, breast pathology, eclampsia, thyroid dysfunction, arthritis, low back pain, fibromyalgia, myofasciitis, asthma, gas, bloating, constipation, Crohn's, diarrhea, food allergies, foul stool odor, gastritis, heartburn, hiatal hernia, IBS, ileocecal valve, malassimilation or weight loss, right? Body odor, bad breath, and all the nervous system stuff, right? Depression, epilepsy, excessive worry, incoordination, irritability, lack of confidence, lack of concentration and memory, mental sluggishness, dullness, schizophrenia, senility, and sensory polyneuritis. So this is a short list of what this bowel toxicity can actually do to the body. So the one downside to gut problems that I want you guys to understand is that there's a similarity between the gut and the brain. And that similarity is that they are both developed out of the same embryological tissue. So in the fetus, when the fetus starts to develop, it's the same tissue that forms both of those systems. And what is the one thing that that tissue does not have? Yes, a Ferrari. No, pain receptors. They don't feel pain, right? You get a headache because you have a blood vessel that is constricted or dilated. You have a headache because you've got excessive toxins around in there and there's a swelling going on. You get a headache because you have muscles contracted in your neck and your shoulders that's referring pain to your head. The brain itself does not have pain receptors. Same with the gut. This is why you can't feel leaky gut issues unless you're bloated, distended, you got cramping, or you feel like crap after you eat certain foods. Constipation, diarrhea, like all those things are indications of that. So how do you know if you've got issues? Well, you got to get tested. Okay? There's a 24-hour urinalysis that I do with my patients that then tests for a lot of these things, and we're going to go over that in a moment. There's another thing is a fasting digestive exam that you can do that I do on my patients to understand where their imbalances are nutritionally. So this integrated urinary panel, basically it's a kit that I give you that you take home to do. And it's a 24-hour, so you collect your urine for a 24-hour period. And it reveals from a chemistry standpoint how your body is actually metabolizing your food. And it gives me a great deal of information from your digestion system. And what does it tell me? Well, we measure indican. Imagine that. Let's see where your levels are with the indican. It talks about dietary stress, right? What does your body have to digest? Protein, fat, carbohydrates. So it gives me a breakdown of what you're eating too much of, and are you even assimilating that food? It talks about absorption rate, mineralization, electrolytes, tonicity, kidney concentration, vitamin C, Or is your body in a catabolic state and breaking down its own tissue to feed itself because your digestion system is very, very weak? So basically what it's looking for is it tells me what is breaking and what organs are involved, but it also tells me, does a pathology screening of what is broken. So this is what this urinary panel actually tells me. Now you combine this with a fasting exam, and what do I mean by a fasting exam? Well, there are these visceral stress points on your body. There's about 40 different ones on your body that tell me something different about a body process or an organ system, nutritionally speaking. So I have you come in first thing in the morning on an empty stomach. We adjust your spine to minimize all of the mechanical stress and neurological stress to your system. Then we check these 43 stress points. Determine which ones are positive. Then I give you a balanced food to eat, which is a tablespoon of food mixed in water that you then consume. We wait 45 minutes to allow your body to digest and absorb and get that nutrition to where it needs to go. If your body can do that efficiently, then the stress point that was there before just disappears because it was nourished. But what if it's positive before, and what if it's positive afterwards? What if you've got 20 different stress points that are double positive? Where do you start? So the fasting physical exam, along with the urinalysis and the chemistry, you get these two pieces of information together, and if this is normal, it tells me where your deviation from normal is at. Once we figure out what's causing that, then we can put you on a program that just brings your body back up into balance. And there's a priority system that has to occur in order to get well. Remember last time we talked, or earlier we talked about there's a sequence for sickness, where there's also is a sequence for getting well and healthy too. And it kind of comes back to the three forms of stress, right? So emotional, nutritional, mechanical. So you can have subluxations and posture issues that are burning up more nutrition in your body, and it can make you more irritable and more emotional. Or if you've got anxiety or depression issues or a relationship issue or grief, that emotional stress can cause nutritional imbalances. The nutritional imbalances can then cause subluxations and posture issues. Or if your diet is crap, you're going to cause inflammation in your gut, which can then cause muscle contraction and subluxations, which then makes you more irritable. So you see how this triad of health, either way, they're all kind of related to one another. So how do we get people well? Well, the very first thing that needs to be done is you have to identify where that source of stress is on your body. Like I said earlier, everybody's their own set of walking chemistry, and everybody is different. So you have to identify where is that primary source of stress. Is your primary source of stress mechanical in nature? Is it emotional in nature? Or is it nutritional in nature? And once you identify where it is, we gotta take our foot off of the gas pedal. If you do not do that first, I guarantee you, your body will not heal, period. You have to take your foot off of that gas pedal, get you out of that sympathetic dominance, and slow the body down in order to heal. Then we gotta examine your body to find out where the weakness is, which we just talked about with the urinalysis and the fasting exam. We got to support homeostasis and innate intelligence. This is the beautiful thing about the body, is that we can count and have faith and trust homeostasis and innate intelligence every single time to do their job. We just got to get out of their way and support them so that they can then do their job. And how do we support homeostasis and innate intelligence? Well, this is where chiropractic adjustments come into play to decrease that nervous interference so your brain can communicate to your body appropriately. There's this emotional breathing release technique that I've done to help people regain that inner peace that they have lost, right? It works very, very well. We got to clean up the diet, strengthen digestion system with enzymes. There's also neurological exercise that you can do to help increase the vagal tone to the gut. And then support any other organ systems that need to be nourished with enzyme nutrition to do their job. And that is basically it. So it's it just kind of rounds it out like that, but you have to understand that there's a certain sequence and a priority that the body does in order to be able to handle itself and for it to heal. Make sense? Okay. Are there any questions on any of this?
Yes.
Fire away.
Well, how do you reduce these toxins? Like, what's already in your system?
So, great question. So that's where figuring out what organ systems are involved and then supporting them. So for each of these stress points, for each one of these stress points, let's say there's a stress point for the kidney, there's a stress point for the spleen, there's a stress point for the liver. So each organ system, for each stress point that's there, I have a product that is nutritionally designed to get rid of that particular stress point, to nourish that organ system specifically. Okay?
Makes sense.
I know.
That's why
I try to make it simple.
So other than these stress points, how do you identify like the inflammation that's like inside the body?
Well, that's where, again, there's certain stress points that can tell me that. There are lymphatic points in the body, right? So like right up here behind the clavicle on both sides is where the lymphatic system dumps the lymphatics back into the bloodstream. So if you've got, rub your fingers there and that's sore and contracted, you have lymphatic congestion, right? So there are stress points that tell me, is it more of a protein issue? So the one thing about Dr. Loomis and this system is that I learned a lot about nutrition in school. And when I went through his training, I had to throw all of that out because he made me look at the body in a completely different way. And it actually is much more simpler this way. So basically we have our three macronutrients, right? Protein, fat, carbohydrates. So we have to be able to break those down, absorb them, and get those macronutrients to the target tissue so they can utilize that for food and do their job. We also have vitamins, minerals, and enzymes. So we got our macronutrients and we got our micronutrients. The macronutrients need to be in balance first. There's a priority with the nutrition before the micronutrients can actually do their job. A lot of times, for example, everybody knows anemia, right? What do people take for anemia? Iron. What does iron do to a lot of people? Constipates them, right? So iron is a micronutrient. Iron goes along with protein metabolism. So if you are protein deficient, not digesting protein, then the iron can't work with the protein to balance it out in the body, which is why a lot of times just taking an iron supplement doesn't work because most women are protein deficient. Majority of my patients in the practice are protein deficient. They just simply do not eat enough protein and they don't digest it very well. Guys, we have no problem with that.
Why would they not be digested?
It's just part of their physiology. I don't know exactly why, but it's just something clinically that I see a lot. So.
This is a little bit strange, but when people have like their gallbladders removed or different organs removed, how does that affect sort of that nerve communication pathway? If they get like replacement lungs, like the
Yeah.
nerves have to.
So yeah, I mean, I have patients who've had their bowels removed. You know, people don't have a spleen, people don't have a gallbladder. You know, and that nerve connection is still there, but I mean, you just don't have an end organ there. I mean, the brain is still sending messages, right? It's just not going anywhere. You know what I mean? So it is a little bit weird, you know. And a lot of times too, when people have their gallbladder removed, in some people, their bodies will actually regrow a gallbladder. Yeah, it's weird. I mean, not going to grow a new spleen, but for whatever reason, research shows and has demonstrated that some people actually regrow a gallbladder. So, but look at the example though too. It's like Why do people get their gallbladder removed? Because it's not working, right? Yeah, stones. Well, why do people get stones? Because there's an underlying digestion issue. How many people have gallbladder issues, get their gallbladder removed, and still have digestion issues? A lot, right? Because they never actually corrected the underlying problem. And the gallbladder and hydrochloric acid in the stomach production, you cannot separate the two. So if you have gallbladder issues, you've got stomach and HCl issues in your stomach. You cannot separate those two. And that's why a lot of people have gallbladder issues, because they have weak stomach issues.
What would cause the stones and how to fix it?
So, good question. So stones are formed, bile has to be flow, right? It has to be like a water consistency, right? So what happens is that if you can't produce enough hydrochloric acid in the stomach, then because the whole reason we have hydrochloric acid in the stomach is to activate enzymes to digest our food. So your stomach can get very, very acidic, like almost down to a pH of like 2, right? And then that goes out into the small intestine. Well, the pH of the gallbladder and bile is very, very alkaline to counterbalance that, okay? So if you can't produce enough hydrochloric acid in the stomach because you don't have the resources in the body to do that, then your body has to adjust. Then the liver reabsorbs certain minerals from the bile that makes the bile more thick and resin-like. And that's what actually creates the stones. So you have to, in order to get rid of the stones, you can do like gallbladder flushes and stuff to get rid of the stones and do things naturally other than having it removed, right? But you have to fix the hydrochloric acid in the stomach in order for it to work. And you got to get to the underlying problem.
What's some scenarios or issues that would cause you to not have the right HCl levels in your stomach?
Well, if you have heartburn or indigestion, right? Bloating, gas, just your normal digestion system symptoms will be an indication of that. A lot of times people have like a hiatal hernia. I mean, with reflux and GERD and stuff like that, people think it's because the stomach overproduces acid. That is a bunch of lies that the medical community has sold you. It is physiologically impossible for your stomach to make too much hydrochloric acid. So the reason why people have heartburn or indigestion is because the mucosal lining is compromised that's in there. And the reason why the mucosal lining is compromised is because they're eating too much crap, right? A lot of soda, a lot of coffee, just alcohol, whatever. And they also have a decrease in vagal tone. That vagus nerve and that vagal tone to the gut is what actually tells that mucosal lining to flourish and to grow and regrow itself. So if you have a decrease in vagal tone to the gut, that can also compromise the mucosal lining.
How do you increase your vagal tone?
There are certain exercises that you can do. I'm not going to give away all my secrets. Ask me on your next visit. I'll show you. Okay. Great questions, though. I love it. What else you got?
How do you tell if your liver and kidneys are overworked?
Well, you can just push in here and see if that's sore and tight. Yeah, it'll be tender. Like right now, this side is very tender on me. This side is not. But the thing too is like with these visceral stress reflexes is that before I adjust you, I can check that to see if it's positive. But if I adjust your spine, it can get rid of that reflex just like that. That's telling me it's more of a mechanical issue and not a nutritional one. But if I were to adjust you and this muscle contraction stays there, then that's telling me it's more of a nutritional issue, not a mechanical one. Or, liver, what emotion is tied to liver? Anger, right? Bitterness, frustration, right? So do you have a particular emotional issue that's going on in your life that is causing the liver to require more nutrients to not work well? See how that works? So you got to keep all three in mind all the time.
Tell me more about this
Indicanuria. It's just a fancy 50-cent word that basically means toxicity, right? So like in the large intestine, when we don't digest our food well, the microbiome in the small intestine, we got good bacteria, we got bad bacteria. We also have opportunistic bugs, right? Yeast, other protozoa, things that are down there, right? It's kind of like a garden. So we have to have a overgrowth of the good guys so they kind of suppress the bad guys, because they work in harmony for us, and it actually works like they are a 12th organ, if you will. They do a lot of healthy functions in the body for different things. But when we eat too much sugar, when we are stressed out, when we have subluxations, when we can't digest our food, then that gives the bad guys an opportunity to overgrow, okay? And when they overgrow, the good guys get suppressed. And this is where people get a lot of bloating, distension, things like that. So then from that happening, it slows down the gut motility and people can become more constipated. And this is where the rotting occurs and the putrefaction occurs, right? Where the food actually starts to rot in your gut, in your large intestine. And the indican is simply a byproduct. It's just what the bacteria are pooping, it's just what it's called, is indican. Okay, it's their poop.
How do you detect lymphatic congestion?
Back behind here, there's certain spots in the body. There's a spot on the lateral wall of the chest and down by the ankle. So there's actually 6 spots on the body that tell me if your lymphatic system is congested.
If people have parts of their lymphatic system removed for cancers and other things, how does that?
So that's the more lymph nodes that they probably get removed if they have cancerous cells and stuff in there. So that's just part of, like people that have, breast cancer or something, they have the lymph nodes removed in that arm, right? You can't take the blood pressure in an arm, you got to do this arm, right? So it does affect them in a negative way, but they can still live. It's kind of like having a spleen removed, right? Or your gallbladder. They can still survive and function, but they just might have a limited capacity of certain things. Okay. Anything from you? Anybody else? Okay. Well, I appreciate your thoughts and your questions. That was awesome. Hopefully you guys learned something tonight. What was one thing that you guys learned that you didn't know before walking in here?
I need to go to Vegas. I mean, no, the thing.
Vegas, baby, Vegas.
No, actually, I didn't realize that the gut doesn't have pain receptors. And I mean, I guess I sort of some level knew the brain didn't, but
Yeah.
that's sort of poor engineering.
Well, or by design. You know what I mean? If every time you ate something, your gut was in pain, how quickly would you stop eating?
Stop eating that pretty quick. Good stuff.
Yeah. Well, human nature.
Emotions are tied to order
Yeah.
and know that. So
Yeah.
certain things, if I am congested, or now that I know that when people are grieving because they lost a
Yeah.
pet, I can tell.
Yeah.
Just like my lungs.
Of course.
It doesn't bother me.
Yeah.
It's just congestion, but see, now that makes sense.
Yeah. And
Worry for like liver and all that.
exactly.
That makes sense.
And do people really get sinus infections? Unless they're blowing like green or a different color out that's not yellow or clear, people don't get a lot of sinus infections. More or less, it's toxicity issues. That's the problem. So if you're going through a change of season or something and your internal environment's cleaning house and it's just, you dump a lot more toxins into the bloodstream and makes your liver and kidneys work harder. I mean, if you know at the change of seasons, you're gonna have 2 or 3 weeks or a month of bad allergies or asthma. 4 weeks prior to that, we can clean up your lymphatic system, support the liver and the kidneys, and you can go through the change of season without any issues. That is a possibility. So,
Keep your magic pills.
all right, your next visit, come on in. We can go over that stuff. So, all right. Well, thank you guys for your attention. I really appreciate you guys coming out. Yeah, that's it.